Welcome everyone. In this video, we will discuss about nuclear grooves in normal and abnormal cervical smears.
Let's start with the introduction about what is nucleus groove. First, nucleus groove are a linear of infolding of the nucleus membrane that appear in the line running along with the long axis of the nucleus. Second, nucleus groove also visible under the light microscopy as thick and elongated indentation. So, the morphology of the nucleus groove such as coffee bean-shaped nuclei and longitudinal indentation or fold nucleus membrane. Third, in Papa-Nicolau-Stern cervical smear, nucleus grooves are subtle and require the high resolution of the microscopy, which are 40 times objective for detection of the groove. How nucleus groove form? The possibility formation of the groove can occur physically and biochemical, which are for physical is due to the way of the smear technique. For example, when the cell begins to spread onto the slide, the nucleus can fold and create the shallow groove. And for biochemical, it causes of the genetic mutation due to the gene mutation or mutative formation. As the cell begins to divide, the groove are formed. It is normally happen during the maturation.
So, this study was conducted using 100 cervical cell samples analyzed through pap smear with Papa-Nicolau-Stern. The samples were taken from women aged 18 to 45 years old. The samples were divided into two main groups, which are benign cells and neoplastic cells. For the benign cell, it has 60 samples that divided 30 with inflammation and 30 without inflammation. For the neoplastic cell, there has 40 samples which were further classified as 20 low cells and 20 high cells, and other half of it with inflammation. So, for this table, it shows the presence of nuclear groove in intermediate squamous cells from cervical smears, grouped by lesion type and whether inflammation was present. For each case, the researchers looked at 100 intermediate squamous cells and counted how many of them had nuclear groove. The average column shows the mean percentage of grooved cells in each group. The range column shows the lowest and highest percentage observed across all samples in that group, meaning how much variation there was from case to case. For example, in benign smear with inflammation, about 9.3% of intermediate squamous cells showed groove, and the values range from 7.5% to 11.1%. What's important here is that benign and low cell smear had relatively low and similar frequencies, whether inflammation was present or not. But in high cell smear, especially without inflammation, the percentage of grooved cells was much higher, average 25%, with some cases as high as 35%. This tells us that nuclear grooves are much more frequent in high-grade lesions, suggesting a potential link to neoplastic changes. So, from this analysis, we compared the presence of nuclear groove in both inflammatory and non-inflammatory samples across all lesion types. The result shows that the frequency of nuclear groove does not significantly change between the samples with and without inflammation. This suggests that inflammation does not influence the formation or visibility of nuclear groove.
So now let's talk about the indication of nuclear groove in the normal cervical smears and abnormal cervical smears. Starts with the normal cervical smears. Nuclear groove can sometimes appear as a benign finding, usually due to hormonal influences. For example, during pregnancy or hormonal therapy, cells can be under the influence of estrogen or progesterone, which may naturally cause the nuclear groove or molding. Endometrial and endocervical cells can also show this, especially in the second half of the menstrual cycles. Another important benign cause is estrella reaction, which is a hormone-related change often seen in pregnancy. These cells typically have large, hyperchromatic nuclei with a groove and clearing, which may even mimic a malignancy, but they are actually non-cancerous. Now, moving on to the abnormal cervical smears. One of the key features is the high cells, or we can call this as high-grade squamous interpolations, is the presence of the grooved nuclei. These are the part of the overall nuclear atypia, which includes a high nucleus to cytoplasm ratio, cross-chromatin, and irregular nuclear membrane. Additionally, endometrial adenocarcinoma cells can exfoliate into the cervix. The cells often have a groove and hypochromatic nuclei, particularly in older women and those with postmenopausal bleeding. In the clear cell of papillary adenocarcinoma, which are types of the cervical cancers, nuclear groove may also be the presence, along with other atypical features. Lastly, viral infection, especially HPV, can cause nuclear abnormalities like groove and clearing. This is referred to as choleliocytosis, which is a hallmark of the virus cytopathic effect in cervical cancer. Overall, we can conclude that while nuclear growth can be benign and hormone-related, especially during pregnancy or menstruation, they can also signal serious pathology such as high-cell carcinomas or HPV infections. Let's start with the normal cervical smears. Nuclear growth can sometimes appear as a benign finding, usually.
To properly identify whether a cervical cell is normal or abnormal, when nuclear growths are seen, it's important to look at several other cell features, not just the groove itself. On the normal cervical cells, nuclear growths are uncommon, and if present, they appear very faint, but in abnormal cervical cells, like those found in high-cell or cancer, nuclear growths are prominent and more frequent. For nuclear size, it is small and uniform in normal, while in abnormal cell, it is enlarged and present pleomorphic, which is various in its size. Next, for the nuclear shape, appear to be round to oval, compared to in abnormal that have irregular or folded nuclear shape. Find an evenly distributed chromatin pattern in normal cell, while in abnormal is either coarse, clump, or hyperchromatic. The NC ratio in normal cervical cell is normal NC ratio, so the cytoplasm is abundant, while in abnormal cervical cell, it is appear high NC ratio, so the cytoplasm is scanty. Lastly, the other features that present in normal cervical cell is no mitotic activity or cell damage, while in abnormal cervical cell is mitosis, apoptosis, or other sign of dysplasia or malignancy.
According to Payande and Cross 2003, nuclear growth are supportive characteristic, not definitive measure to indicate diagnosis. Despite its ability to appear in a variety of cervical cells, there are overlapping other features that can help us determine specific diagnosis between the low cell, high cell, and SCC. Since nuclear growth are considered not definitive, therefore to indicate the interpretation of cell, we choose and focus only on significant characteristics shown. Here, for example, of low cell, even it have nuclear growth appearance, but it doesn't indicate 100% it's a low cell. We focus further on other characteristics, which are high NC ratio with nucleus enlargement, choleliocytic changes, abundant cytoplasm, and slightly coarse chromatin. Okay, next, high cell. Nuclear growth are prominent here in high cell due to the chromatin remodeling and nuclear membrane alteration are intense, where in low cell, the changes are milder. Therefore, growth appearance here were taken as supportive characteristic along with other significant features to indicate that it is a low high cell, which are high NC ratio with nucleus enlargement, hyperchromatic, irregular nucleus membrane, and coarse chromatin. Last one is SCC. Growths are likely absent in SCC because the nuclear architectures are often pleomorphic and disrupted. Here I wanted to highlight again if we do found nuclear growth in any related cases such low cell, high cell, and SCC, even in benign also, it's just taken as a supportive characteristic and not diagnostic that able to determine the interpretation of cells.
What are the limitations of nuclear grooves and why nuclear grooves alone cannot be fully relied upon to make a definitive diagnosis? The first limitation is lack of specificity. According to the research by Payande and Cross 2003, we can determine that nuclear grooves can appear in both benign, normal or reactive, and malignant cells. Therefore, their presence is not exclusive only to cancerous cells. Next, subjectivity in interpretation. According to Giovanni et al. 2011, the appearance of grooves depend on the observer's judgment. Different pathologists may interpret the same cells differently.
The third limitation is potential for overdiagnosis. According to the research by Malheros et al. 2018, if pathologists overly focus on nuclear growths alone, benign conditions might be mistaken for malignancy, leading to false positive diagnosis and unnecessary concern or treatment. Next, we will continue with the discussion of mimickers. This discussion is to answer the question of what nuclear pattern that could look similar to nuclear grooves. In this slide, you can see there is a similar pattern which is caterpillar nuclei that is quite different but similar to the nuclear grooves. As for nuclear grooves on the left image, you can see that it is more fine longitudinal membrane lines and is usually caused by nuclear membrane infolding. For the caterpillar nuclei, the appearance is single central wavy chromatin bar that is usually caused by chromatin aggregation, and it is not due to membrane changes.
What are the significance of the nuclear grooves in cancerous cell? Nuclear grooves cannot be fully relied to make a definitive diagnosis. However, the high number of nuclear grooves can indicate prognosis and the aggressiveness of the tumor cell. Fortunately, the frequency of nuclear grooves does not indicate the overall survival. Overall survival is from the date of the diagnosis or the day start of treatment that patient diagnosed with a disease are still alive. Therefore, there is no significant association found between nuclear scores and patient survival. However, based on Fuhrman grade, which is a grade system used to assess nuclear features such as size, shape, and nucleoli of the tumor cell, indicate the higher number of nuclear grooves in the smear, the higher the Fuhrman grade. Fuhrman grade is started from grade 1, least aggressive, to grade 4, most aggressive. Therefore, the higher the number of the nuclear grooves, the higher the Fuhrman grade, and this indicates the grade 4 worse prognosis and more aggressive tumor behavior.
Lastly, conclusion. Nuclear growths are morphological features observed in both benign and malignant epithelial cells across different tissue types. While their presence alone may not always indicate malignancy, studies have shown that increased frequency of nuclear growth, especially in high-grade or specific tumor subtypes, and may be associated with neoplastic progression. Although their diagnostic or prognostic value remains contact-dependent, recognizing nuclear growth can support cytological and histopathological assessment in various clinical settings. I think that's all from us. Thank you.